You know, we will always have important health challenges to face. We talk about the emerging and re-emerging infections, HIV and other infections, Zika, CHIKV. We've got to do research to better understand these diseases and health challenges in order to make a difference. Of course, with the significant improvement of health in the Caribbean, we've been able to transform what was a major problem, childhood malnutrition. 30% of all pediatric admissions in the 1960s was due to malnutrition, and with or without gastroenteritis. Now that is not the problem, it is the opposite. The significant obesity and the associated chronic non-communicable diseases. And when you look at our primary healthcare services and you look at the fact that we are seeing thousands of persons with hypertension, diabetes, and we are simply not being able to control these diseases effectively, despite the time that we spend with our patients. So this is a tremendous challenge which young epidemiologists, researchers, clinicians, all health associated persons face. We have to do better. Then there are the questions of mental health. Now, if we're going to be effective with research, you have to be an independent, critical thinker. You've got to be creative. You have to be willing to take chances. You can't just swim with the tide. You have to think for yourself. You have to ask yourself hard questions, and you have to work out, what can we try that is different? What can we do that is different? Do I dare to say something that does not sound right, or that the majority are not talking about? Sometimes there is too much political correctness. When we get together as researchers, as epidemiologists, as clinicians, we need to ask ourselves, are we really on the right path? Are we doing what we need to do? And it bothers me somewhat that I don't think that we are being sufficiently independent and critical in our thinking. I will also say that in order to better understand the challenges we face, we have to engage more with your patients. You can learn a lot from them. You can get insights. Engage with other health staff who are not engaged in research but are providing service. Engage with anyone who has an interest, and engage with an open mind. And too often now, you know, the only one who is speaking in public is maybe the Minister of Health or a politician. The health professionals have to engage more actively and communicate with the public more effectively. And we have to be less sensitive when we're engaging with our colleagues, so that we can challenge each other more forcefully in a fraternal, respectful manner, in order to really try and search the solutions we need to continue to improve the health of our people.
Making evidence determine how we organize and run our health service. The current distribution of the health team was based on work that was done in the 1970s. So how many nurses, midwives, doctors are out there in the public sector are based on the population that existed at that time. Well, I mean, the population is twice what it was back then. Have we done anything to expand the cadre of the health team at the community level? So we must go back to a system where, on a routine and consistent basis, we are using the evidence to guide public health policy and access to care. And then, of course, people have to be willing to use the information to guide policy. A lot of us, I remember going into a hospital after the perinatal study, and none of the babies in that hospital had gotten something that was very basic. And when I asked the matron, well, why aren't you giving the babies this thing? She says, well, when she went to nursing school, they didn't teach that. We can't say that, well, this is what we were taught when we went to school, and we don't care about information and anything else. One of the courses that I teach to the undergraduates in collaboration with a team from the Epidemiology Research Unit is a course called Understanding Research, where what we aim to teach medical students is how to look at a problem, how to investigate that problem, how to solve it, and how to respond and use that information effectively. Because 50% of what they learn in the 5 years that they are here is going to be obsolete by the time they graduate. How are they going to respond to new information, new health problems? They need to learn how to use information to guide what they are going to do in the future.
So far, we've been working on the area of chronic diseases, and there is still a lot more to do, especially in terms of interventions. These diseases are occurring much earlier than you used to see. So the nutritionists in the health centers, they are reporting obesity and overweight in children younger and younger. So the 2-year-olds are, getting overweight and obese. So I think that's a major area that needs to be tackled. And there's a lot to be done there in terms of intervention and so on. In terms of my own area of work in child development, we're very happy that the government of Jamaica is now launching Reach Up, and although this is just a phase 1, we're expecting an expansion beyond that. So these are some things that need to be worked on. And I think for epidemiologists, it's a very exciting time. They have a lot more knowledge now, and they have the tools, and they have help. They have people that they can tap. They don't have to feel alone. A few years ago, decades ago, they would be by themselves working, maybe just out one person in a Caribbean island without any resources to tap into. Now there's a network of people that they can tap into. So I think it's a very exciting time for health research and health researchers.
Chronic diseases, by their very nature, the nexus between exposure, or the so-called risk factors, and the outcome is not as clear-cut. I mean, we know measles. You're not going to get measles unless you're exposed to the measles virus. But there are people who smoke all their life and never get lung cancer. But we know that the chance of getting lung cancer is greater among people who smoke. Over the last 30 years, what I've seen is a recognition of the complexity of these diseases, and the development of some very interesting tools to try and disentangle the causal model, and be able to tackle the factors, complex situations. And thankfully, the ICT, information and computer technology, has grown and is now much more helpful in trying to disentangle the others. We now hear of things like multi-level modeling. So rather we're talking about too much salt on this side and too much hypertension, but then you need to, on top of that, it's now no longer 2-dimensional, maybe 3 or 4-dimensional issues. Behavior comes in there, how the society treats the globalization, the issues of the economics of a society, how does a poor country like ours protect itself from the dumping of cheap food, whether it be sugar, too much sugar, too much fats or trans fats, and preserves its health, while at the same time meeting the demands of things like the World Trade Organization. And how do we reduce inequity? Inequity, I think, is going to be a major issue that needs to be tackled by the next set of researchers. Both inequity in terms of the exposure, inequity in terms of provision of care, and so on. And then globalization, because the world is just one little village nowadays. You could be in Hong Kong this morning and be in London this evening, and the spread of diseases. And then, of course, security, how that impacts health. We talk about people must exercise. Do we have safe spaces to exercise? If exercise is a pillar of a good lifestyle, a healthy lifestyle, how do you make sure that that is so? So I suspect that in all of that, perhaps the one thing that I envisage and I'm fascinated by is going to be the need for health researchers from a variety of specialties to come together to try and solve this problem. So we're not going to do it without some anthropologists in the mix, some social scientists in the mix. The biologists need to be there to understand the mechanisms. The clinicians need to be there to treat the diseases when they do occur. And so I envisage health research, or research for health, which is now the buzzword, rather than health research. I envisage that research for health is going to have to be very collaborative, very open-minded, and involving all sectors of the society, from the economists and the financiers to the local government people who create societies and create communities, to the people who control security to make sure spaces are safe, to the agricultural sector who's going to produce sufficient amounts of the so-called healthy foods that we must eat. And to me, the centerpiece of research for health going forward is going to be how well we collaborate across all the specialties that have an impact on society, because all of them are going to have an impact on health.